The Guardian is reporting that Cuba has become the first country to eliminate the transmission of HIV and syphilis from mother to baby, according to the World Health Organization, whose director, Margaret Chan, said it is one of the greatest public health achievements possible, and it is a step towards an AIDS-free generation. Over the last 5 years, Caribbean countries have had increased access to antiretroviral drugs as part of a regional initiative to eliminate mother-to-child transmission. HIV and syphilis testing for pregnant women and their partners, as well as C-section deliveries and substitution of breastfeeding, have contributed to breaking this infection chain that goes on from mother to child. It's estimated that each year 1.4 million women living with HIV become pregnant. If they're not treated, 15 to 45% will transmit the HIV to their child during pregnancy, labor, or breastfeeding. That risk drops to just over 1% if the mother and baby are both treated with antiretrovirals. This is absolutely huge. And Cuba has also made really big advancements when it comes to cancer treatments. And there's a lot of curiosity about why. Why is this happening in Cuba? Part of this, not all, but part of this is because they do have a nationalized healthcare system known to ignorant right-wingers as evil communism. There are obviously tens of thousands of HIV positive women in the US who would want a baby, but who wouldn't be able to afford this antiretroviral therapy or a mandatory C-section, or periodic checkups for 18 months, etc. If it weren't for money, everyone would be able to have access to that, Lewis. In fact, if it weren't for money, we could prevent a lot of disease in the US by having everybody undergo an MRI every once in a while and see their doctor on a monthly basis. A lot of conditions and diseases would be caught earlier. We don't have that. Obviously, we hear about rationed care when you have socialized medicine. It's also rationed when we have a for-profit system the way we do in the US, given that people don't have unlimited budgets, and thus people don't always get their conditions detected early. They're not able to start treatment as early as maybe they should. So part of what's been going on in Cuba is that they have a socialized healthcare system.
Yeah, that's a part of it, and it's fascinating that this is the country it happens in, despite the embargo and all of that. They're not in the best situation there. But yeah, I mean, it's great news.
And
And
and interestingly, Lewis, the news is really public health and political news, right? It's not a medical research breakthrough. We know exactly what needs to be done to prevent mother to child HIV transmission. The medical knowledge has been there for years. It's more about the limits of privatized healthcare and what Cuba is able to do given the system they have.
yeah, and it's it looks great. I wish we could implement such a system here. There's just really too much misinformation and too many powerful companies lobbying against it.